love for kids just keeps on growing.
Brea is a little girl who came to us initially at about 5 to 6 months of age with a severe infection. In part of her workup, it was found that she had a very limited immune system, and a diagnosis of severe combined immunodeficiency was made. The therapy of choice for patients with severe combined immunodeficiency, or SCIDS as it's commonly called, is transplantation.
When they told me that bone marrow transplant was her treatment, everything was going through my head. And I went to the doctor the next morning, and I looked at him and I said, so, worst case scenario, a bone marrow transplant, right? And he looked at me and he said, actually, that's very good. You are very, very lucky that this is a treatable condition.
There was not an available family donor, so cord blood was utilized as a stem cell source for Brea. Brea underwent transplant with minimal complications and actually stayed with us for a significant amount of time, so we got to watch Brea grow up in our transplant unit. So we felt as though we were part of Brea's family.
You know, you would never think that something so important could be in that little vial. And it was about 31 cc's of cord blood that saved my baby's life.
Cord blood stem cells are isolated from the placenta, the afterbirth, after delivery of a baby. It's not blood that we take from the baby or from the mother, but actually drained from this afterbirth or the placenta. And those stem cells have the ability to form all of the cells within the bone marrow.
The St. Louis Cord Blood Bank is the ultimate recycling program. We take cord blood stem cells that are no longer needed by a child or its mother, and we turn it into a gift to another person.
The first time that I learned about cord donation was with Alexis when I was pregnant. In my doctor's office, there was a brochure. Here, there was this perfect opportunity to do something extraordinary for another life, and at the same time that I'm having a baby, which is the most extraordinary moment. I like to tell my husband, you know, in making this decision and thinking about it afterwards, that if you walked up, you know, with your plastic bottle, with your water bottle, and you had the decision to either throw it in the recycling bin or throw it in the trash, you would obviously pick the recycling bin. And that's how easy this decision is when you're thinking about it, to go ahead and use this for something better.
Cord blood stem cells are so valuable in our setting because they can be obtained without any of the ethical controversy that comes with embryonic stem cells or fetal stem cells. They are considered adult stem cells, and I think that distinction is very difficult for people sometimes to understand because, you know, you think about cord blood stem cells, you think baby, and then your mind logically goes to thinking about embryonic stem cells, and that's not true.
Cord blood is an exciting resource for which its full potential is yet to be realized. We know that cord blood is a viable stem cell source for bone marrow transplantation. However, other applications are yet to be realized.
We think that we can encourage these cells to become other things like bone and cartilage and neurons and be able to treat folks with neurological problems or to recreate bone mass in people. We're not there yet, but we think that we have the potential to do those things just like with embryonic cells.
In order to realize its potential, I think that it's going to require a greater understanding of the general public on the need to have cord blood stem cells, and as well as a greater understanding of our legislators in understanding the potential use of cord blood versus other stem cell sources.
When we see children like Brea Powers and others like her, and we see that we have successfully intervened in stopping their illness, it's very, very fulfilling. Everyone at the Cord Blood Bank feels that same sense of empowerment in being able to do that.
As a parent myself, I think about how it would feel with my children meaning so much to me, how a parent would feel to really want to give their own special child something that they don't have within their possession to give them. especially something they need to watch their child live and grow and develop and have all these opportunities that the world has to offer. And I can't imagine myself as a parent how that would feel to not be able to provide that for your child. This is the first gift. Umbilical cord donation is the first gift. I'm thankful for the opportunity to be able to do something at a very vulnerable time for me and for my baby, and to be able to have that example of giving right off the bat.
My daughter's life was saved by bone marrow transplant from cord blood, giving her a chance to live a perfectly normal life. She's a very happy baby, full of personality, and dances around and plays with her sister. And thank you so much for giving my baby that chance.